Every day, hundreds of sick and injured people reach out to AtlantiCare in their time of need. AtlantiCare's vision is to build healthy communities, from premature infants to adolescents to new parents to those enjoying their golden years. We strive to make a difference for every person we touch. We reach out and identify the most vulnerable members of our community, such as those with hard-to-manage medical conditions and those with no permanent home. Our Mission Healthcare program provides medical care, prescriptions, and counseling for the homeless. Our intent is to offer quality medical treatment, but many say they are most thankful for being treated with dignity.
We put an application in 2003 for healthcare for the homeless, so that we've been designated to treat homeless. And the federal definition of homelessness is very broad. So it encompasses not only those individuals that are residing in the Atlantic City Rescue Shelter, but anyone who's living on the streets, in abandoned hotels or cars, and also it encompasses those individuals that have recently lost their housing and are doubling up with families or friends. So the face of homelessness has really changed, especially in the past couple of years with the recession. Many individuals have lost their homes and are living doubled up with friends or family or residing in the Mission, in the rescue shelter, so that we are taking care of a broad spectrum of patients that come to our doors. We also do this through an open access model of care, so that any individual that comes into the center can access care that day. So we see many medical conditions in healthcare for the homeless. Among them are diabetes, hypertension, COPD, depression, alcoholism, and drug addiction. The beauty of our center is that we take care of an integrated health care for the homeless, so that we're providing all these services along with transportation, 340B program, case management. So anyone that walks into our center gets an array of services that really is focused on their integrated health. Through the program that we offer at Mission Healthcare, we're really able to work encouragingly with our diabetic patients and have them come back monthly to see the doctor, to see the diabetic educator, to see the registered dietitian, to get their eye exams and their foot exams. And this way we're able to really have an impact on their numbers, so to speak. We have a psychiatrist on staff that's able to see our patients that have any mental health conditions such as anxiety, depression, schizophrenia. We also offer an intensive substance abuse program. So many of our patients have comorbidities that include depression and alcoholism or drug addiction, and we offer a detox program from opiates. We also offer an intensive outpatient program. Our patients go through this program to learn how to live, without substances. So we feel that we've made a big impact just by being co-located with the Atlantic City Rescue Mission. In addition, many of the patients come to us and say on a daily basis, this is the first time ever that I feel like I've been treated with dignity and respect. The financial impact that Mission Healthcare has had on all of AtlantiCare is really reducing the cost per patient visit. So when many of these patients had gone to the ED and could cost upwards of $1,000 per visit, we're able to provide that cost at $300 to $400 per visit. So we feel that we've made a tremendous impact on, one, offering, access to service more timely throughout the day rather than accessing the ED. Mission Healthcare is funded through HRSA, which is a federal grant. We also have various state and county grants that help fund Mission Healthcare. And then the rest of our funding comes through patient revenue, which is Medicaid, Medicare, some third party, and an uncompensated pool that comes from the state of New Jersey. Some of the future goals for Mission Healthcare include becoming a patient-centered medical home recognized through NCQA. And that application is going to be going in November of 2011, and we hope to attain Level 2 status for our patient-centered medical home. We have also goals of being able to renovate and construct our main site so that we can have more exam rooms, 4 additional exam rooms, and office space to accommodate providing more volume of services to healthcare for the homeless patients.
By reaching out to our community and being here when people reach out to us, we are touching lives. We are making a difference. We are AtlantiCare.
AtlantiCare.